Ministry of Public Health of Ukraine. Krok 1. Medicine. Year 2017. Number 106. Pathologic material, mucosal excretion from the nasal passages, obtained from a patient provisionally diagnosed with influenza was delivered to the virological laboratory. What quick test allows detecting specific viral antigen in the investigated material? A. Hemagglutination inhibition assay, HI. B. Radioimmunoassay, RIHA. C. Reverse indirect Hemagglutination, RIHA. D. Direct and indirect enzyme-linked immunosorbent assay, ELISA. E. Direct and indirect immunofluorescence, if. Viral antigen is a protein encoded by the viral genome, that can be detected by a specific immunological response. Direct immunofluorescence uses a fluorophore conjugated antibody to stain the target protein. Indirect immunofluorescence involves first binding the primary antibody to the target, then detecting the primary antibody using a conjugated secondary antibody. In the most simple form of enzyme-linked immunosorbent assay, antigens from the sample to be tested are attached to a surface. Then, a matching antibody is applied over the surface so it can bind their antigen. This antibody is linked to an enzyme and then any unbound antibodies are removed. In the final step, a substance containing the enzyme's substrate is added. If there was binding, the subsequent reaction produces a detectable signal, most commonly a color change. Hemagglutination inhibition assay is used to titrate the antibody response to a viral infection. It takes advantage of some virus's ability to hemagglutinate bind red blood cells. If the antibodies to the virus exist, hemagglutination occurs, and if no such antibody exists, hemagglutination does not occur. Indirect hemagglutination test is a kind of passive agglutination in which erythrocytes are used to adsorb soluble antigen onto their surface, and which then agglutinate in the presence of antiserum specific for the adsorbed antigen. The passive and reverse passive both are indirect hemagglutination test. The difference is only that the former is used for the quantification of antibodies and the latter, virus. Radioimmunoassay is a technique for determining antibody levels by introducing an antigen labeled with a radioisotope and measuring the subsequent radioactivity of the antibody component. The answer is E. Direct and indirect immunofluorescence, if